Have you ever been told, congratulations, your gestational diabetes is gone? If so, this video is for you. Hi, I'm Dr. Jessica Poland. I'm an MFM OBGYN physician. Here on Femme MD, I help women navigate pregnancy, postpartum recovery, and long-term health after baby. Because while your blood sugars may return to normal after delivery, gestational diabetes is actually one of the biggest warning signs that your body can give us about your future health. Here's the problem. Many women never hear about it again after they leave the hospital or complete their 6-week visit. Today, we're going to talk about what gestational diabetes really means, your future risk of type 2 diabetes and cardiovascular disease, and most importantly, what you can do to protect your health right now for years to come. So what exactly is gestational diabetes? Gestational diabetes is a form of diabetes that develops during your pregnancy. During pregnancy, the placenta produces hormones that help your baby to grow and to thrive. The downside is that many of these hormones actually make your body more resistant to insulin. Most women are able to compensate by just producing more insulin, but some women cannot keep up with the increased demand. As a result, blood sugar levels rise and gestational diabetes develops. This is why I often tell my patients that gestational diabetes is largely a placental disease. Once the placenta is delivered, those hormones disappear and the blood sugars often return to normal. But that doesn't necessarily mean the story is completely over. One of the biggest misconceptions I see is that women assume a normal postpartum glucose tolerance test means they're completely in the clear, but that's not actually how this works. Think of your pregnancy as a stress test for your metabolism. Gestational diabetes is your body telling us that it struggled during that test. Here's the statistic that every woman should know and that gets my attention as a maternal-fetal medicine physician. Studies suggest that up to half of women who have gestational diabetes will at some point in life go on to develop type 2 diabetes if no preventative measures are taken. Guys, that's huge. That's a statistic worth paying attention to. In fact, a large meta-analysis published with the British Medical Journal found that women who had a history of gestational diabetes had a nearly 10-fold risk of developing type 2 diabetes compared with women who had a normal pregnancy. The risk is highest in the first few years after the pregnancy, but it does persist for decades. In other words, gestational diabetes is not just a pregnancy diagnosis. It's one of the earliest warning signs that we have that your metabolism may need attention long after your baby's born. It's not just the diabetes. Women with a history of gestational diabetes also have higher rates of prediabetes, metabolic syndrome, high blood pressure, and cardiovascular disease. If you've had gestational diabetes, your postpartum health matters just as much as your pregnancy health. So why many women miss the follow-up? One of the biggest challenges is that life gets very busy after delivery. You're caring for your newborn, sleeping in short stretches, returning to work, focusing on everyone else's needs except for your own. Understandably, your own long-term health often falls at the very bottom of the list. Current recommendations are that women with gestational diabetes complete postpartum diabetes screening, usually 6 to 12 weeks after delivery. Yet many women never get that test. And if you do get that test and it's normal, that doesn't necessarily mean that you're off the hook forever. You should continue periodic screening throughout your life. As a maternal-fetal medicine physician, I also see another really important consequence of missing that follow-up. Many women skip their postpartum follow-up glucose testing, feel well, and then get pregnant again. They're often referred to me early in pregnancy because their blood sugars or their A1C is elevated. In some cases, what started as gestational diabetes in a prior pregnancy has actually progressed to prediabetes or type 2 between the pregnancies, and they didn't know it because they didn't have any symptoms. This really matters because high blood sugars are very dangerous early in pregnancy, and even they can be more dangerous than gestational diabetes that's diagnosed later in the pregnancy. Elevated blood sugars, particularly during the first trimester, are associated with an increased risk for miscarriage and certain birth defects because this is when the baby's organs are forming. That's one more reason why postpartum screening is so very important. It's not just about your health years down the road. It can also help identify problems for a future pregnancy and give you the opportunity to optimize your health before conception. What are some signs that your metabolism may still need attention? Many women assume they would feel if something was wrong. The reason this matters is that prediabetes and type 2 diabetes are often insidious, silent diseases. Many women feel completely well while their blood sugars are developing abnormalities behind the scenes. However, some women do experience clues, and these clues can include difficulty losing your pregnancy weight, increased abdominal weight gain, fatigue, sugar cravings, elevated blood sugar, and abnormal cholesterol levels. These symptoms don't automatically mean diabetes, but they certainly can be signs that your metabolic health deserves a closer look. So, what can you do right now? There is good news. A history of gestational diabetes doesn't necessarily mean you're destined to develop type 2 diabetes. In fact, this is where you have tremendous power. Here are 6 things that I strongly recommend. Number 1, know your numbers. Knowledge is power. Make sure you've completed that postpartum glucose screening. Know your fasting glucose, hemoglobin A1C, blood pressure, and cholesterol levels. You can't improve what you don't know. Number 2, build your muscle. Muscle is one of the body's biggest glucose users. Strength training helps improve insulin sensitivity and it lowers your diabetes risk. This does not require a gym membership. Body weight exercises, resistance bands, and short strength workouts can make all the difference. Number 3, focus on protein and fiber. Rather than chasing restrictive diets, focus on meals that will stabilize your blood sugar. Aim to include protein, fiber-rich vegetables, healthy fats, Mediterranean diet. These foods help to reduce glucose spikes and they improve your feeling of fullness. Number 4, prioritize sleep. I know, you're a mom. I am too. I have 4 kids. Sleep may feel impossible. Chronic sleep deprivation worsens your insulin resistance. Do what you can to protect your sleep and accept help when it's available. Number 5, stay active. Even a daily walk, short, can improve your insulin sensitivity. It also improves your mood. You don't need intense workouts. Consistency matters more than perfection. Number 6, continue a healthy eating pattern. So guys, one of the biggest mistakes that I see in my clinic is women returning to the same bad eating habits they had before pregnancy because the gestational diabetes is gone. Instead, continue many of the healthy habits that helped you during your pregnancy to achieve success. Focus on a Mediterranean-style diet eating pattern. This is rich in vegetables, lean proteins, healthy fats, beans, nuts, whole grains, and fish. Limit highly processed foods and white carbohydrates like white bread, white rice, pastries, sugary drinks, and sweets. This is not about perfection. However, this is about supporting your metabolic health for the long term. Focus on the bigger picture. One of the things I tell my patients is that gestational diabetes is not just about pregnancy, it's actually about your future health. Your pregnancy gave us valuable information about your body. Now we can actually use that information to take action years before problems develop. That's incredibly powerful. Prevention is much, much easier than treatment. We also know that women with a history of gestational diabetes have higher rates of blood pressure, metabolic syndrome, and cardiovascular disease later in life. That's why I don't think of gestational diabetes simply as a pregnancy problem. I think of it as an early warning sign and an opportunity for prevention. If you've had gestational diabetes, don't panic, but don't ignore it either, mama. Use it as valuable information about your future health. Get screened, know your numbers, continue healthy habits, build muscle, stay active. And remember, just because the pregnancy is over doesn't mean your health journey is over. If you found this video helpful, subscribe to Vital Femme MD for more physician-led information about postpartum recovery, women's health, and long-term wellness after baby. And if you've had gestational diabetes, let me know in the comments. Were you ever told that your future diabetes risk persists after your delivery? Until next time, Mama, take care of yourself. I'll see you in the comments.